Hello guys, now I will present you this case 52. It is an ankle. I will scroll down the images so you can have a brief idea about what I have to tell you about this case. This is a young male, 15 years old, a lot of basketball play. So what can we see? At first glance there is a fracture line here, which is quite specific for a stress fracture near Achilles tendon insertion. There is a small edema, bone marrow edema around it. There are other bone marrow edema areas here in the anterior aspect of the talus. There is fluid inside tibiotalar joint. Let's take a look at the cartilage. So the cartilage seems to be alright, maybe some problems here, but without any bone marrow edema around, so probably an old cartilaginous problems. You see these problems in the metaphysis, which might be physiological, but they also could be due to stress. There is inequality of gross plate ossification, probably due to overuse. The main issue here, which is this area here, it's fluid signal, it's on the distal fibula, and if you come down to see it better, you will see that it goes above the metaphysis. You see it here, it's from here to here, around 4 centimeters. You can better see it on coronal images. So what is this? This is probably stripped periosteum with haematoma underneath. And if we go lower in the distal part, we see a syndesmotic ligament, fibulo-tibial ligament here, and going further we see there is no normal fibulo-talar ligament, anterior fibulo-talar ligament, ATFL. We see some fibers here which are torn. There is a clear discontinuity here and a lot of edema in the soft tissues around here. This is PTFL, posterior tibiofibular ligament, which looks normal. And let's take a look at fibulo-calcanean ligament, which is torn, which is the second ligament which appear torn after ATFL. You see, regarding that periosteal stripped, I did an oblique image so I can see this better. Take a look at this. You see, this is periosteum, this is haematoma, and this is cortex. I also have axial T1, which shows this fluid here, which is a bit bright, so confirms that there is blood in it. T2, axial T2, the same findings. And I want to see a better coronal PD with FATSAT, and I do not have one, so maybe we'll see on this one. Are we looking for the fibulo-calcanean ligament, which is here like a hammock here? Okay, this fine line, thin line coming through this, it looks to be intact. We can see it here like a hammock. It's coming like this and inserts on the calcaneus here and on the tip of the fibula here. Okay, so let's take a look again at this stress fracture line here, and now I am ready to show you the evolution after 8 or 9 months. This patient had another MRI because he had another accident, and we see that the haematoma disappears. The periosteum is nicely seen, no problems here. Anterior fibulo-tibial ligament, the syndesmotic one. Then the lack of ATFL, which is of course still torn, but inflammation around it, it's no longer there. But now, because the patient had another trauma, now we see there is a very thickened fibulo-calcanean ligament. Is this ligament here, and we see the distal part, the calcaneal part, which is very thickened now, and it's not continuous with this part here. So this is very interesting, because he managed to rupture this fibulo-calcanean ligament in two parts. First he torn only so in the first trauma he managed to tear ATFL, and on the second trauma, after 9 months, he managed to tear fibulo-calcanean ligament. So this is the calcanean part, okay, here, and it's completely discontinuous here. And then let's see the proximal part, which is probably here, okay, but it's not continuous with the distal part whatsoever. So complete torn of ATFL and fibulo-calcanean ligament, one old, one new. Let's see what happened with the fracture stress line. Seems to be almost completely resolved. There is no other issue. There is still some inflammation here, and also the metaphyseal changes from here and from here seems to be alright. So probably they are only physiological due to overuse. Thank you for watching. Subscribe to my channel if you want to be up to date to the future talks and future cases. Any comments would be welcome in my YouTube channel or Facebook. Thank you again.